down. Is any disaster unnatural? We have the ability, it's remarkable to cycle through the seasons of death.
In the future, talk radio will actually educate, inspire, and make you think. The future is now. Topics and music that affect your life from Universal Broadcasting Network. Tune in at ubnradio.com.
And it's that time again, folks. Greetings and salutations. Welcome to Dr. Judy, WTF, and I am Walt Lusk, your host, as usual. We are broadcasting live, as usual, from the Sunset Gower Studios here in the middle of Hollywood. And as usual, we have the illustrious Dr. Judy Rosenberg in studio today. We are continuing our series on matters of the heart. And as usual, we will be doing a Shrink That Tune later. It's actually one by Arctic Monkeys. It's going to be a fun one by personal request. So welcome to the show. Thanks for listening. And if you want to check us out, we are at www.drjudywtf.com. And we are on Facebook and Twitter of same. So.
And this is a continuation of our Valentine's series because as some of you may have listened in last week, we did one on matters of the heart because it was right near Valentine's Day, and now it's just right after Valentine's Day. And I thought, why shouldn't we consider our hearts? Because after all, this is a show about human connection and healing human disconnect. And what is more painful than when our hearts are broken and when our needs are not met? And when we pick people that don't really serve us well. So today we're going to talk a lot about, is your picker broken? Who do you pick? How do you pick? How do you base? What kinds of bonds are you supposed to be looking for that sustain over time?
Is your picker broken? Does picking your nose count?
That one counts a lot because it seems like a very popular hobby these days. I watch people in their cars, and it seems to be, rampant. It's kind of like road rage, road pickings.
Well, it sounds safer. It sounds safer than road rage.
Well, I don't know. If you're preoccupied, does this look like a road hazard? They have tickets for that. Anyway.
Yes, they do.
Getting back to matters of the heart.
The thing is, wanted to start with when you're in love, lots of wonderful things happen, as we all know. Mm-hmm. And so I thought I would go over a couple things regarding the body, all right? And so there was cardiac events. You have a healthier heart. Cardiac events were reduced a lot with guys that were married and women that were married as well. Mm-hmm. And we all know that more heart attacks happen between 9 in the morning and noon on Mondays than anything else.
Stress time. Which
is a stress time, mm-hmm. which means your job might be killing you, mm-hmm. but if you are married, you can probably get through a little better. Mm-hmm. Second one is your mental health improves. Men in committed relationships are better physical health, and women in committed relationships are in better mental health. So, because they both place greater importance on the relationship itself.
And take into consideration, going back to what I talk about each segment of our show, that what we need as human beings is the same thing we always needed, which is touch, eye contact, heart to heart, skin to skin, which is the touch, and unconditional love in the form of consistency, in the form of kindness and regard. And that isn't going to change anytime soon.
No, and if you have any comments in that regard, this is a call-in show, and we welcome any and all calls if you can hear our voice. And the call-in phone number is 323-284-7826. And if you call in today, you will get a copy of Dr. Judy's brand new book called Lucid Darkness.
And, I want to hear from you about how Valentine's Day went for you, because that's a very loaded day, and people don't know whether they did a good job by picking the right restaurant or the right bouquet of flowers or the right gift. And oftentimes it's a lot of pressure on people because no matter how they are and where they are in the relationship, somehow Valentine's Day amplifies the ideal of love. And somehow if things don't turn out ideally, there's a real sense of a letdown. And so please do pick up the phone, because I want to know what was in your mind planned for that day and what actually happened, and what kind of a letdown did you have, or maybe were you pleasantly surprised. And we also know that Valentine's Day is a day that people sometimes will propose marriage.
Sometimes, although I think that's a little cliche personally.
Actually, I know somebody
who
who popped the question.
I know.
This Valentine's
for me,
Day.
Valentine's Day is the same as Mother's Day. You pay a lot, get a little, and take forever to get it. In a
Wow.
in a restaurant.
In a restaurant. Oh, okay. Okay. So tonight we're going to talk a lot about relationships. This is a very, very big topic, very common topic of wanting to know more. Why? Because our heart matters. And as Walt, you were saying, physiologically, we are really, really built to connect. And when that connection doesn't go right, when the feelings don't flow both ways, then it hurts. And oftentimes what happens is that the feelings only flow one way, and that's a painful thing, because really what we want in a relationship, whether it be a romantic relationship or even a friendship, is we want mutuality. We want reciprocity. And so for those of you who are familiar with my work and you're familiar with my 9 panels, just go ahead and put it up there.
And you can check out the 9 panels. I want to put them up. But if you're just listening, you can go to our website again, drjudywtf.com. And it's a system that Dr. Judy developed over 9 panels, 12 years ago.
Yeah. Yeah. And
still
using them every day of my work life.
The response in therapy is Judy keeps calling me and telling me stories of clients, and it's just unbelievable.
I just wanted to say that one of the complaints that I get from patients who come in to see me and have been in previous therapies is that they spend an awful lot of money on venting. And oftentimes there's no real game plan. And the second complaint is that although they get possible symptom relief for short periods of time, they never feel like they get long-term sustainable symptom relief. And the reason for that is because the therapist forgets a very important aspect. I'm not going to say all therapists do. Certainly some therapists are very responsible and thorough. The way I view it is that if you don't get to the cause, if you don't get to the wound, and you don't get to the reaction and the encoding of the wound, and it's all up there on my panels. Panel 1 is representative of the wound, and then the reaction to the wound, and the encoding is how we encode our self-esteem. And if that doesn't go well, then we're tripped up. We're tripped up by triggers. So if our core belief is that we're stupid or unlovable or ugly or fat or any of those things, then even an innocent look can be construed as, are you looking at me that way because you think I'm stupid? And
Wow.
And this is a misperception. And part of the work that I do is that I correct the misperceptions which occur because when we're infants, we sponge in the fiber of our being through looking into the eyes of our caregivers. And if the caregivers are benevolent, if the caregivers give us what I call the emotional supplies, the narcissistic supplies, if you will, that make for a healthy human being, then we don't we don't encode a sense of lack of. And when we feel full and nourished emotionally, well, then that's the basis of good mental health. And if we're mentally healthy, then guess what? We pick mentally healthy partners because
That is
law
true.
of attraction,
Yep.
health seeks health.
Health seeks health.
Yes.
Okay.
Exactly.
Well, it's interesting because the next thing here is when you're in love, you produce fewer stress hormones. Okay, from a study. Although marriages can be pretty stressful, it could make it easier for people to handle other stresses in their lives.
Right, because again, if you're under stress and your loved one comes and puts their hand on, just even on your forehead or on your heart, or looks into your eyes and makes that connection, then the blood pressure goes down, the blood flows, there's color in your cheeks, right?
Yes.
There's this kind of a sense of slowing down the breathing and a feeling that we're not alone. And that is precious.
Well, the cliche phrase I use and talk to folks all the time is shared sorrow is half sorrow, and shared joy is double joy.
Beautifully
Yeah.
said.
Shared sorrow is half sorrow, and shared joy is double joy.
And so whenever we think of Valentine's Day, what do we think of? A heart, right?
Yes.
Valentine's Day heart. And what does the heart represent? Love.
Right. Well,
Connection.
correct. Love,
Right?
connection, and
Right. So here we are making a really big deal of celebrating love, which is the most powerful healing force on the planet. I can't say it enough times.
unconditional love. Yep.
Is
That's right.
the most powerful healing force on the planet and the most underutilized healing force on the planet. We would rather Skype, we would rather text, we would rather eat, we would rather do anything than what we really, really want, which is basically connect.
Well,
We want to
here's a connection.
Thank you, thank you, thank you. I didn't know we had such a big audience.
Oh,
Well,
absolutely we do. You'd have no idea. The next, in terms of being in love with your health, is you could experience less pain. And love could be a painkiller. You know, even sometimes looking at photos of your romantic partner activates the brain's reward system, and therefore you have less pain.
So is that why when women give birth, they insist that their husbands come in? So
No, they just want to yell at him and say, "Look what you did to me."
And that's less pain for them. Yeah, that too, right? That's called projection. Look at panel number 6 on the mind map, and you'll see that instead of suppressing, you can express. And
Yeah, and about
Yeah.
5 minutes after the whole thing, they want to have another baby. It's like, oh, I could do that. again.
amazing.
Yes, isn't
How
that amazing?
soon we forget, right?
As my father said, who was a physician, he says the maternal instinct is very strong. You could have lower blood pressure. It might ratchet up your blood pressure when your partner forgets to take out the trash again, but overall, it is a boom to releasing and in reducing your blood pressure.
Do you have any statistics in terms of how much longer people live when they're in healthy relationships? I recall seeing something along those
Not
lines.
offhand. All I know is, for example, typically, if there's been a long-term relationship with a husband and a wife, and the wife passes away first, typically the husband goes within 2 years.
And what about if the husband passes away?
No, the wives usually last a lot longer, and the
Okay.
reason is because
I mean, what about the opposite?
yeah, the opposite. Wives
Right.
live longer because
Yeah.
typically they have a lot more of a social network. And they have girlfriends and stuff that they've done and do, and they can go hang out with, and that kind of relieves the pressure of that and the loneliness.
Do you notice that in the cases with many men, and men, I really would like to hear from you, that the number one best friend of the man is usually the wife.
Yes, that's true.
Or the girlfriend.
Yes.
And that one person is their world. Whereas
Yes.
with women, you'll see women having close relationships with their mothers, their sisters, their aunts, their cousins, their girlfriends, their children, and it's not so with men.
No, it's
so,
Yeah, I think women have easier time getting and developing relationships with women specifically than guys with guys. You know, so
So this is all making sense. It's back to attachment theory. John Bowlby, father of attachment theory, who talks about the ingredients to emotional health. And when we're talking about lowering blood pressure and having greater health in general, then we can see that this goes right back to the first few minutes and weeks and months of life, and physiologically tested over time that the human touch and that human connection is a healing touch.
absolutely it is. I mean, even if someone's in the hospital and they're in a coma, and you hold their hand and you talk to them and you have some human connection, many times that they'll experience it or feel it, or it'll assist in their getting better faster.
You know, it reminds me of a book that I read many years ago by Jill Bolt Taylor, who was she studied strokes. She was involved in treating patients who were stroke victims, and she had a stroke of her own, and she literally watched all of her mechanism shut down, and ultimately she found herself in a state of being.
Right.
And when she got into the state of being, it was a very, very spiritual experience for her. And she noticed all kinds of energy fields, and she noticed that people who were unconditionally loving and attending to her would increase her feelings of comfort and security. But when care providers came in that really didn't give a damn, that didn't show the empathy, she would find herself getting really anxious, and she'd find herself wanting to get that energy out of the room. So we're really, really energetically sensitive.
Well, again, I'm a big believer also in the vibration, in the vibe, right? There's
Right.
people that you meet that they haven't said one word to you,
Right.
and you already have this view of like, I don't think I'm going to like this person.
Yeah.
Or a person
Yeah.
will walk up and you go, hey, man, I really think I might like this person. It's a vibrational thing, I think.
And, today I had the privilege of going back to one of my old schools, which is Paul Mitchell, the school, and being invited to go there by Win Claybach, who's a remarkable man, and he wrote a book called Be Nice or Else. And let me tell you something.
Be
This-
nice or
or
else.
Be nice or else. And so he invited me to come and hear him speak. And this man is just such a joy and such a bundle of energy and positive energy. And he was talking about how sensitive he is to energy and the vibrations, and that he's one
There
of
it
those
is.
people,
There it is.
as am I, that picks up on other people's energy. So he has to be really, really careful about who he chooses to hang out with. And we all have to be careful.
You know what? It's
And-
true.
And especially
Absolutely.
in picking a mate,
Yes.
picking a significant other, the vibrational level of that person, because we are now permeable to that person, because we're opening our hearts and we're also opening our bodies sexually to that person. So that energy is flowing into us. And if that energy isn't healthy energy, if it's not sharing energy, if it's not unconditionally loving energy, then what we experience is what I refer to in the first few years of life. We now get infiltrated with their darkness. And that's not fun. And if you put
it's
the
not.
panels up, you can see panel number 1, which is where the wound occurs. So if we were infiltrated by our family of origin with a lot of negativity and criticism and emotional cutoff, and now our loved ones are re-injuring us in the same way, then what will happen is we will ingest that vibration, we'll digest the vibration, we'll manifest the vibration, and we'll eventually break down into chaos. And nobody likes to be in chaos. So what do we do when we're in chaos, Walt? Do you know the rap?
We implode or explode.
No, one before that. We defend.
We defend it, right,
We
that's penalty. We
defend
defend
the
it.
chaos. We defend against the wound. And we defend
We do
against the
everything we
reaction.
can to defend against our wound because we've lived with it since we were probably born with it.
Yeah, we don't want it
And
touched.
We don't want to mess with it because it's
No.
like part of us.
No.
Big part of us.
And so when we're in a loving relationship, sometimes we recapitulate the original wound, which is why we call the show Dr. Judy WTF,
WTF.
because we're Freudian repetition principle, repeating the past in order to grow out of the past and morph the past. But sometimes it doesn't work out that way, and we just repeat these wounds and we re-injure ourselves, and then we go reeling into chaos.
And if you're in chaos or feel you're looping with your wounds, you know what? You can get on the couch with Dr. Judy. All you got to do is pick up the phone and call us at 323-284-7826. And you'll even get a book. Her first fiction book titled
So much fun.
Lucid Darkness.
So much fun. A little
was
bit
a fun
about the
book.
book. It's about a psychologist who creates a mind map. Sound familiar?
What a coinky dink.
Yeah, what a quinky dink. In order to heal human disconnect. And she starts out lecturing at Royce Hall, UCLA. And there's always the shadow in the audience. And there's always this sense that her attempt to heal human disconnect, although it's welcome, is not so welcome in certain parts of the world. And she ends up in Gaza City, and she's not that welcome there.
No, she's not. It's a psychological, pardon the pun, thriller.
Yes. And it's just a very fun way to learn a little bit more about the thinking of why it's so important to heal human disconnect, and why it is that we've become fractured into races and religions and
As you
social
say, isms.
classes. And I call them our isms.
Isms, yeah.
And eventually we clash as a human race because we don't accept each other, and we become so diversified and so unaccepting of the diversity that we don't really know how to come together as a united humanity. Our biggest challenge to finally come together as a united humanity. And it starts with mother-infant connection, because how the heck are we going to come together as a united humanity if we can't even get the nurturing from our own mother? So we got to get it right from the get-go. And then, of course, there's father,
Yes.
who represents the outside
Yes.
world.
Your mother, the relationship you have with your mother as an infant is a reflection of your inner world.
Mm-hmm.
And of course, the relationship you have with your father is a relation to your outer world.
Right.
And if you don't have any of those, you are in the
double
Dungeon.
dungeon, which means that there's a sense of darkness from within, which is things gone wrong with your mother, and then darkness from without, which represents things gone wrong with your father, and then you have no place to turn. So in terms of choosing relationships, if you come from the consciousness of darkness within and darkness without, what are you going to choose? You're going to choose a person who's pretty dark.
Yes,
Right?
Yeah, you are. Either
And-
that or you're trying to, well, we've even discussed in previous shows how you pick that person and you want to rewrite the script and in hopes and anticipation of it having a happier ending,
Right.
which it rarely, if ever, does.
Right. And if you've seen the movie Groundhog Day, you'll see that the character keeps morphing and morphing.
Bill
and
Murray.
morphing. Thank you. And each redo is just a little bit closer
He gets
to
it- he
learning
gets it
the
right.
lesson.
Yep, he gets it right.
And
Mhm.
eventually he gets it right. Do you
Yep.
remember the lesson?
I don't.
I don't either, but I know that it had to do, I haven't seen it in a long time, but I know it had to do with getting right, connecting with the person
Yeah, he was-
that he wanted to connect with, because he was very in love with a woman. And,
Yes, he was.
and it just wasn't going right
No.
until he had to figure out how to give up his ego,
And,
right?
and,
His
as I
selfishness
understand, he
in
had to
order
learn.
to-
He had to learn how to ask questions. But the issue is, you have to ask the right questions. Right? If you just ask questions, you're going to get any answer. But if you have to ask her better questions, then you're going to get a little better answer, and therefore have a little
So
more
let's
information.
talk about that, because there are a lot of you out there who may be in a relationship, or you may be single and wondering, how do I pick the right relationship? And somebody recently asked me, how do you make sure that you're in a good thing? And I said, pick well. And it starts with being well. And when we're well, we pick well. So what are the things to look for? I look for ethics. I look for somebody who's ethical, somebody who keeps their word, because I don't care how handsome or rich or smart or anything they are. If they are unethical, to me, that means that they're not safe. And if they're not safe, I don't want to go there. I don't
Right.
want to mix my energy up. I don't
Absolutely.
want to expose my heart to that person. So ethics and mental health are really, really closely related. So you want to look for signs like, does this person keep their word? If they say they're going to call, do they call? If they say they're going to show up at a certain time, do they show up
Are
at
they
a certain
on time?
And if they're not on time, and we're not perfect, I know I'm not perfect, do they call and say, hey, I'm running 5 minutes late, so just know that I'm on my way and I'll be there. There's a certain way that everyone wants to be regarded, and it's back to treat others as you want to be treated. So the first principle is ethics. Look for somebody ethical. Another thing that I think is wise to look at is somebody who is emotionally generous.
There you go.
Okay,
Yeah.
and one of the signs
Oh,
of
probably generous in a lot of aspects. But,
yes, it crosses over.
But yeah, it spills over.
Yeah, if somebody is, leaving a 5% tip, okay, or 10%, or even, they're not generous tippers. Chances are they're not generous people, and they're not going to be emotionally generous. And you can look at it again as the wound. They didn't get all the supplies, so now they don't feel that they have a lot to give. So what is emotional?
Or they have a shortage mentality, right? Because
Right.
if you're stingy, you feel you're not going to get more.
Right. As if there's not enough love to go around.
Right. There's a
Not
finite.
enough
There's
money to go
a
around.
finite amount, which
Right.
there's infinite.
Right.
Infinite money, infinite love. I mean, and just because you love somebody doesn't mean you can't love somebody else less.
Do you remember that experiment they did with ants, and they had a jar full of ants, and the ant, I think it was fleas. Sorry, fleas. Okay, jar full of fleas, and the fleas were jumping up and down in this jar. And what they did was they put the lid on, and so every time they got to the top of the jar, they knew that there was a lid there, and they wouldn't jump any higher than the lid because they didn't want to smack their bodies up into the lid. And then the experimenter took off the lid, and guess what happened?
They didn't jump any higher.
They did not jump any
Right.
higher.
They did not.
Okay? And that's like us. When we have limiting thoughts, limiting core beliefs, when we have limited views of abundance.
Yes.
Right?
Same thing with
You
an
talk a lot about that with
yes,
me.
we talk a lot about it.
Abundance.
And the same thing with an elephant. When they're younger, they put them in a stake in the ground that they can't pull out.
Right.
And then when they're older, they just put a stick in the ground, and the elephant doesn't know any difference because, the elephant could pull that sucker out in one little step.
Right. So just
Same thing. It's
right.
conditioning.
So I look for somebody who has unlimited capacity to connect and love and share and grow, creativity, which is the foundation of growth. An individual who is willing, this is really important, you guys, listen to this carefully, the ability to self-reflect, meaning owning your own stuff.
You mean you have to co-sign your own
huge.
BS?
You have to. You
Yeah.
have to keep your side of the fence really clean. So if you're in an argument or something's not going right, you have to share with that other person your piece in it. Because if you're attacking, criticizing, blaming, and shaming, what you're going to get is you're going to get a bunch of defense mechanisms. You're not going to open that person's heart and soul up and have them start self-reflecting, because now they're like, keep away from me. I don't want to.
Walls go.
I don't want to deal with you. So if you want to be the cause of defense mechanisms, you can easily just try criticizing, blaming, and shaming. You will see your loved one clam up.
Yep.
And, end game, at the end of that journey, you're probably going to have a clash of the isms.
And you know what? If you're married, you're going to live longer. It says here that a spouse may be after you to eat better and go to the doctor, because I know you ladies go to the doctor way more than we do. And sometimes it's easier to be healthier and less of a risk taker when you're married.
Well, because you have another human being to spot check you.
Yeah.
Honey, I see this really crazy looking mole on your back. Maybe you need to check it out.
Absolutely.
Like, sweetie, did you notice that, crazy things happen? Like, did you see the blood in your urine? That's a bad one. And then people get scared to go to the doctor, but if they have their spouse as a support system or a loved one as a support system, they can say something like, I'm really scared, will you come with me? Yeah, I'll come with you.
Sure.
And then that takes the resistance down to go to the doctor and take care of yourself.
That is true.
So please call in. I really want to hear from you guys.
Yeah, call in. Our number is
I feel like I'm talking so much.
323-284-7826. 323-284-7826. And a couple more real quick on when you're in love, what your body does. You might get better sleep. Women specifically are happy in marriages and they sleep better than their unhappy and unmarried counterparts. You might have more and even better sex.
Well,
Married people
that
may
makes
actually
sense.
be more active between the sheets than their single counterparts, and oral sex is also a lot more common. So there you go. And you
All
end
the
up with
benefits.
yes, indeed. Friends with benefits. And stronger immune system, lower blood pressure, and even, interestingly, an increased libido. you're probably happier, and lastly, you produce feel-good chemicals, the dopamine.
And you know, I just recall the days when I used to work at an old age home, and I treated a lot of the elderly, and I found a very, very high level of alcohol use and abuse. And why? Why were they using so much alcohol? Why were they using their medication to over-medicate themselves? I'll tell you why. Why do you think, Walt? Why do you think the elderly would be so...
Well, they're probably lonely.
There we go.
I mean, even
They're
though
lonely.
you're in a room full of other elderly people who have been through life and probably had similar experiences, right? I mean, older folks have been through the Depression and World War II and all that sort of thing, and or you know, the Korean War or whatever. They are alone.
They're alone. That's right. And when you're alone, there's no dopamine in your brain.
Right.
There's no endorphins pumping through you. And so what do? Is you self-medicate to stimulate the pleasure centers in the brain. I have the privilege of communicating with one of the people that I greatly admire in my profession, and really they're few and far between. And this gentleman is a doctor. His name is Dr. Gabor Mate, and he, like I am
As a fellow Hungarian. Yeah.
Holocaust survivor parents, and he was relating a story about himself as an infant. Actually, you can Google him, Dr. Gabor Mate, and he does TED Talks, and I'm really, really very, very eager to talk to him and exchange ideas. I think we think alike, and hopefully that conversation has now been opened up.
Oh, I believe it has.
Yeah, and so Dr. Mate was talking about how when he was born in 1944 in Budapest, Hungary, which is where I'm from, he was crying and could not be consoled as an infant.
Oh, you told me this story.
Such a great story, and his mother called the pediatrician and said, you know, my son is crying and he won't stop crying, and the pediatrician said, you know, all the Jewish babies are crying, and the message is that these Jewish babies that were arriving in a world that was not welcoming Jewish babies, hauling them off to death camps,
Right.
and incinerating them.
Right.
They had that vibrational
And again, we're back to that vibe.
knowledge
We're back
in
to
the
that
fiber
vibration.
of their being.
Yes.
And of course, the mothers that were nursing them also had that level of fear and depression and hopelessness and darkness in them, because it was really hard to stay light when you were being murdered. And so the babies were soaking in all of this into the fiber of their being, and so their systems were feeling it. And so now we know that babies feel a lot
Yes, they
more
do.
and experience a lot more than we think. And I'm really impressed to see that the doulas and some of the people who are in the field of helping mothers give birth are now encouraging mothers to have lotus births, whereby they birth the placenta along with the baby, and they keep the umbilical cord intact so that the babies can have the antibodies and the nourishment and the connection.
Right.
Yeah. So
And then we talked a little bit about the kangaroo position, where the baby is put on the chest of the mother or the father with a cap on, of course, a diaper, and they get that skin-to-skin contact.
Right.
And if they put their ear to the chest, they can hear the heartbeat.
And we know now, and I have a lot of people in my practice who I call incubator babies.
Yes, we talked a little bit about that a
We
show or two
did,
ago.
We did, and we can see that the result on the adult, when exposed to that incubator and not exposed to the touch and the warmth of the mother, is there's a sense of alienation and loneliness,
Yes.
and a sense of really not being comfortable in their own skin, because they're lacking something. If they don't know what they're lacking, because they can't remember this.
Well, they can't communicate it.
Correct.
Right?
Right.
I mean,
It's
they're unable.
pre-verbal.
Yeah, and they
Right.
are unable to communicate it
Right.
other than cry, right?
Right. Exactly.
And if you feel like crying, you can call in. You are listening to Dr. Judy WTF here on the UBN Radio Network. here in Hollywood. And I am your host, Walt Lusk. And, of course, we have Dr. Judy Rosenberg, who is a full-time clinical psychologist and marriage and family child counselor here in the Los Angeles area. And we're going to be expanding her practice and ability to interact with folks pretty soon here on Skype. So stay tuned for that. So if you can hear our voice, you can have a session with Dr. Judy.
And yes, I just want to mention that if you don't live in Los Angeles and you would like to work with me, that's easy to arrange.
Very easy.
Just get on my website, Dr. Judy WTF. Email me, call me, and we can set up
You
a
call
mind map
info
Skype session.
at Dr. Judy WTF, and she's even taking sessions at 3 o'clock in the morning. She never sleeps.
Oh, no, I am. Thanks, Walt. Give me a break. Well, sometimes in emergencies I'll do that.
So last week we finished the show with 15 things where men kind of show affection without saying I love you, which is kind of a fun thing. And Judy actually found this is 21 rules that men have. So I thought we'd have some fun at our expense. So the first one is men are not mind readers. Sorry, we just aren't, right? I mean, we all know what the definition of the word
We want you to
assume.
be, though.
I know you want us to be.
We want you to
and we all know the definition of the word assume, ASSUME. Second is learn to work the toilet seat, okay? You're a big girl. If it's up, put it down. We need it up. You need it down. You don't hear us complaining when it's left down. Next, crying is blackmail.
Huh. Really? I like that one, actually.
Yeah.
Manipulative.
Ask for what you want. Let's be clear on this one. Subtle hints don't work. Strong hints don't work. Oblivious hints don't work. Just say it. We can handle it. I assure you. Next, of 21 rules that men have, yes and no are perfectly acceptable answers to any question. Yes?
Yes.
Come to us with a problem only if you want help solving it. That's what we do. We are problem solvers. We're hunters and problem solvers.
You mean you're not empathic beings that just will listen and take it in and absorb our pain? And
We can be empathic, but while we're trying to be empathic, we're thinking of, okay, what can I do to help her fix this problem so it doesn't come up anymore? Right?
So wait, let me ask you something. So what if the woman says, honey, I don't want you to do anything about it. I just want you to listen. Now what? Does does that create brain freeze right there?
No, it doesn't. But those of you
Okay.
who are close to the internet, you can look up on YouTube. It's about a 2-minute expose. I've even played it for Judy. It's called "It's Not About the Nail."
Love that one.
Yeah, NAIL.
So much
it's
fun.
not about the nail. It's a couple chatting. It's hilarious.
Yes.
Yeah. 21 rules that men have. Next one, this I think was Judy's favorite. Anything we said 6 months ago is inadmissible in an argument. In fact, all comments are null and void after 7 days.
Really?
Yeah, you guys are like elephants. You don't forget.
And you just
ladies
want to
don't
move
forget.
on.
Absolutely.
So, okay.
We're real big with compartmentalizing. So move on. If you think you're fat, you probably are. Don't ask. Right? Does this make my butt look big? Okay.
My favorite reply to that, does this make my butt look big, was, no, honey, your butt makes your butt look
There you go.
big.
If something we said can be interpreted 2 ways, and one of the ways makes you sad or angry, we really did mean the other one. You can either ask us to do something or tell us how you want it done, not both. If you already know best how to do it, just do it yourself. Whenever possible, please say whatever you have to during the commercials.
Especially if it's football, right?
For those who like football, yeah. Christopher Columbus did not need directions, and neither do we. It doesn't matter if we're making really good.
What's up with that, Walt?
It doesn't matter if we're making really good time down the interstate, and it might be in the wrong direction. We're still making good time.
Right. You guys don't like to be told what to do.
No, we just don't want to admit we're wrong.
Oh, is that it?
Yeah.
Okay.
Although I
like these. Go ahead.
Although a true guy will admit he's wrong and he'll apologize.
And guys, call in. I want to hear what you think about these 21 pointers here. Go ahead.
All men see in 16 colors. like Windows default settings. Peach, for example, is a fruit, not a color. Pumpkin is also a fruit. We have no idea what mauve is, and my favorite is teal.
Teal?
Even though I know
You don't know what it
No,
is?
it's a green color. I know, it's too
okay.
funny. If you ask what is wrong and if ask what is wrong and you say nothing, we act like nothing is wrong, right? But it is just not worth the hassle. We know you're lying.
So if we give you a facial expression looking like there's something wrong, but we say that there's nothing wrong, you go with what we're saying, not what
Pretty
we're
much,
looking.
because it might not be worth the hassle, or we
okay.
don't want to know the answer,
I
or
see, I see.
unless you're sitting in the car and there's nothing on the radio.
And that's like going back to you're not mind readers.
Correct.
Yeah.
When we have to go somewhere, absolutely anything you wear is fine. Really.
Really?
Really.
I didn't know that. Okay.
Yes, whenever you have to go somewhere, absolutely anything is fine. Really. True.
Okay, I'll try to internalize that one. Okay?
You know what? If you're thinking you want to don't want to wear jeans to this event, we love women in tight jeans. Okay, it works for us just great. Okay, so anything works just fine. Okay. Don't ask us what we're thinking about unless you are prepared to discuss such topics as football and motorsports.
And that's what you're thinking.
No, I'm not.
Not you.
Not
Not
me.
you.
Not me,
you,
but
no.
a lot of guys are. And then lastly, a couple quick ones of 21 things that men rules that we have. You have enough clothes. You have too many shoes. And I am a shape. Round is a shape.
And no way will a woman ever buy into the idea that they have enough clothes and they have enough shoes. That's just not.
I
gonna
had one lady
fly.
friend that she had a closet full of clothes, and if she bought 5 new items, she had to pull 5 out in replacement. So she never got a closet full of clothes.
Actually, I like that concept because I personally am not a hoarder. I love things clean and organized, and I will go through my closet. I just gave a bunch of stuff to Helping Hands for the Blind.
There you go.
And they will pick up and they'll just haul it off. And, but part of what we think as women, at least I think, is the way we present. And having lived in that beauty industry, Paul Mitchell graduate, hairstylist, and one of the things that Wynn Claybach said today was, look, this is the beauty industry. If you're not going to wear makeup, you're not going to do your hair, you're not going to get dressed up, then just, be a nurse.
Stay home.
Don't be in the beauty industry.
Yeah.
Okay, so we're and of course we come from a culture of beauty.
Yes,
and,
we do, especially here in Los Angeles.
One of the things that I do is I help people become dating ready. I have a website called getdatingready.com, which is really a great website to read if you want to know more about matters of the heart, because in the site is discussed what makes for sustainable bonds, what makes for sustainable relationships. And nobody wants to bother to open up and start communicating and start getting that deep into another human being unless there's a good chance that this thing has staying power.
Right, and in staying power, I have to do one more here since we're picking on guys, and I'm one, so I'm guilty of some of these. These are 10 things husbands are incapable of doing themselves. And ladies, if you think any of these are funny, it's not too late. You can call in and add to the list. First one is washing clothes, specifically our bath towel. You know what? If it doesn't smell really, really bad, no worries. We're still going to use it. Changing the sheets. Cooking decent meals, sorting the mail, refilling the soap dispenser. I don't get that one.
Okay.
Cleaning up the kitchen. You guys have to remember that no man was ever shot in the back while doing the dishes. Okay, it's very important. And I got one here that if you do the dishes, it's guaranteed you'll get more sex. Promise. Try it for a month, and if not, call the show. Buying things like toilet paper and toothpaste. Making doctor's appointments. We've already talked about that one. We're terrible at doing that. Okay. Shopping for clothes, personal items. And lastly, keeping the kids' schedules. When I had kids, I kind of knew them, but you know what? My ex was the mission control, and that's the way it went.
So tonight, we once again focused on matters of the heart, and I really, really, really would love to hear from you. It's not too late to call in. If any of you want to have
323-284-7826.
questions, go for it.
323-284-7826. We'd love to hear from you and get in the couch with Dr. Judy. And it's about that time for us to shrink that tune.
Okay.
This is a fast hour. We may have to
I
expand the
know.
number of hours we're on
Okay.
air. So we're going to do a song by the Arctic Monkeys, and what we're going to do is we're going to read the lyrics, and Dr. Judy is going to shrink it through her mind map, and then we're going to play the song. So the song we've picked by request was "Do I Wanna Know?"
One of my favorite songs. I'm obsessed with it.
See, I really
love this.
I really wonder who requested it.
Yes.
Have you got color in your cheeks? Do you ever get that fear that you can't shift? The type that sticks around like cement? I don't even know. SUMMAT. We asked about it before the show. In your teeth. Are there some aces up your sleeve? Have you no idea that you're in deep?
Okay, so here is the prototype really for the fear that there's not going to be the connection. You know, do you have color in your cheeks? Are you available? Are you alive? Are you
Is your heart beating?
Is your heart beating? Do you get the fear that you can't shift? That deep fear that, you know, this love isn't going to go so well. This is scary. Vulnerability is scary. So I think that there's this kind of an allusion to the vulnerability, and that now, wow, you know, have you no idea that you're in deep, like falling in love, the concept of falling in love, we go so deep that at some point we're in it and we're vulnerable.
And if you're in a new relationship, being vulnerable, it can be scary.
Yes.
Yeah. I dreamt about you nearly every night this week. How many secrets can you keep? Because there's this true tune I found that makes me think of somehow I played it on repeat until I fall asleep spilling drinks on my settee.
Okay, so dreaming about the person, the obsession, the sense that they don't really want to let that person go, and they're just playing the tune and the taste and the smell of the person incessantly until they fall asleep. And, you know, the idea that they're drinking, they're inebriated with alcohol because the pain of love and unrequited love and love that just doesn't connect well is really scary. So to bridge that love, there's obsession. That's a really nice bridge for love.
Interesting.
Yeah.
Do I want to know if this feeling flows both ways? Sad to see you go, was sort of hoping that you'd stay. Baby, we both know that the nights were mainly made for saying things that you can't say tomorrow day.
The truth dialogue. Nights were for saying things that you can't really say. So, you know, when do we really say the truth is when we're really vulnerable. Mm-hmm. So, do I want to know? Do the feelings flow both ways? Do you love me as much as you?
So I love you.
Mm-hmm. Is it flowing both ways, or am I wasting my time and putting my heart into a person that's not going to generate love back? Sad to see you go. Wow, there's the abandonment stuff. Was hoping that you'd stay, and you know, there's that fear that maybe the love doesn't flow both ways, and so you're not going to stay. That's pretty devastating.
Well, as I say, it's a two-way freeway. But here's the line: crawling back to you. Ever thought of calling when you had a few? Of course, we've all had those drunk calls, right?
Yeah.
'Cause I always do. Maybe I'm too busy being yours to fall for somebody new. Now I've thought it through. Crawling back to you.
Right. So there's the addiction. I'm crawling back to you. I've gone in deep. And even if I think you may not want me, you know, if I get a little bit inebriated, a little bit high, have a few drinks, I could break through that barrier. Mm-hmm. Have you ever thought of calling me when you're drunk dialing? Is that what they call it? You know, because that'll feel good that you're thinking of me then. Maybe I'm busy being yours to fall for somebody new. Like, no, there's no room in my heart for somebody new. I'm obsessed with you. I'm crawling back to you.
There it is.
Yeah.
So, have you got the guts? Been wondering if your heart's still open and if you want to know what time it shuts? Simmer down and pucker up. I'm sorry to interrupt. It's just I'm constantly on the cusp of trying to kiss you. I don't know if you feel the same as I do, but we could be together if you wanted to. Ooh, what was some insecurities?
Such beautiful words. You know,
Yeah.
I want to know what time your heart shuts. Like, how open are you to me? Do I have just like a slight window of vulnerability? Because I want to get in there. I want to kiss you. I want to get with you. But I don't know if you feel the same as I do. But I hope you do, because I'm obsessed with you, and I'm just gonna be magnetized to keep crawling back to you.
And we'll just do the chorus one more time. Do you want to know if this feeling flows both ways? Sad to see you go. Was sort of hoping you'd stay. Baby, we both know that the nights were mainly made for saying things that you couldn't say tomorrow day. Crawling back to you. So that's our song. Arctic Monkeys, Do I Want to Know? And if you have a song you'd like us to shrink, feel free to send it to info@drjudywtf.com, or you can send us a note on Facebook, Dr. Judy WTF. And I am your host, Walt Lusk. You've been listening to Dr. Judy WTF with Dr. Judy Rosenberg. And you can tune in next week for another exciting show. And thanks for listening. So here is our tune entitled, Do I Want to Know? God bless everyone.
God bless.
Got color in your cheeks. Do you ever get that feel that you can't shift, the type that sticks around like summits in your teeth? Are there some aces up your sleeve? Have you no idea that you're in deep? I dreamt about you nearly every night this week. How many secrets can you keep? 'Cause there's this tune I found that makes me think of you somehow, and I play it on repeat until I fall asleep, spilling drinks on my settee. Do I wanna know if this feeling flows both ways? Sad to see you go. Sorta hoping that you'd stay. That the nights were mainly made for saying things that you can't say tomorrow day. Crawling back to you. Never thought of calling when you're at you, 'cause I always do. Maybe I'm too busy being lost to fall for somebody new. Now I thought it through. Crawling back to you. So have you got the goods? Been wondering if your heart's still open, and if so, I wanna know what time it should. Simmer down and pucker up. I'm sorry to interrupt, it's just I'm constantly on the cusp. I've tried to kiss you. I don't know if you feel the same as I do, but we could be together if you wanted to. Do I wanna know if this feeling flows both ways? Sad to see you go. We're sorta hoping